How are you doing?
Pretty good.
What's going on, Wendy?
Ever since the birth of my first child about 3.5 years ago, I've been struggling with urinary incontinence. I've had to change my lifestyle a bunch since having the issues with my bladder. I am currently nursing a 6-month-old little girl, and I was wondering if there's any safe treatments. I know medication does not work when you're nursing, and I'd like to nurse for another 6 months. So, do you have any other solutions besides medication?
Now, have you had your bladder examined, by a gynecologist or urologist?
Yes, I have. I've actually seen 2 specialists, and they've diagnosed me as stress incontinent and a little bit of urge incontinence.
Basically, there's a few different kinds of incontinence, and the stress incontinence is usually when you have, you cough or you sneeze, you have a change in intra-abdominal pressure that causes those pelvic muscles to, become relaxed, and then you leak urine. And with urge incontinence, you get that urgency, and basically those muscles aren't strong enough to hold, so you just can't get to the bathroom in time before you leak. So she's a combination of the two. With urge incontinence, there are medications. With stress incontinence, the best thing is usually surgery, and there's different types of surgeries now with using mesh slings and things like that, also where they basically, suspend the urethra up so that it changes that angle so that you get rid of the stress urinary incontinence. There's also bulking agents that they can put either around the urethra or within the walls of the urethra. There's a new a process called macroplastique, where they actually inject a toothpaste-like gel into the urethra to change the diameter of the urethra so that that helps with the incontinence. So there are options. I think you need to do a little doctor shopping because you do want a good quality of life to be able to enjoy it, do the things you do, and be able to do this for a long time. Even if you need a different procedure down the road, you don't want to have a miserable life for at least 10 years of that time, right?
Right, definitely.
That's great. And you know what? I'm going to hook you up with some of those doctors, okay?
Oh, that would be wonderful.
All right.
Thank you.
You're welcome.
Thanks, Wendy.